This year, though, we have a very important issue on the ballot here in Colorado, and that is the issue of Proposition 106 and the legalization of physician-assisted suicide in Colorado. Just a couple of facts for you. We are the only state in the country in November that has a ballot initiative concerning this issue. So truly the eyes of the nation are upon us as we vote on this issue. The group Compassion and Choices that is behind the effort to pass this initiative is hoping that it passes in Colorado so that it will spread like wildfire everywhere else across the United States. Colorado is being used as a battleground state for this issue in the hopes that it will build momentum to get this passed in other states around the country. So we have a lot at stake when it comes to this election this November, and we have a lot at stake specifically, not only for our country, but specifically for Colorado. I want to talk a little bit about what physician-assisted suicide is, what Proposition 106 would do if it were to become law in Colorado, and give you some of the statistics behind where this came from, what it means, and where we go from here as we get ready to vote this November. First, I want to start with what is physician-assisted suicide? We know from polling that we did in August around this issue that many people, actually the vast majority of people in Colorado, believe, and this is their words, not mine, that physician-assisted suicide is similar to taking your dog to the vet and having them put down. That a loved one would go to a clinic or a hospital, they would get a shot, and they would peacefully drift off into eternal sleep. It would be quick, it would be painless, and that would be the end of it. That is not what physician-assisted suicide is. If it was, we could understand why people feel so strongly that it should be passed, if that's what they're thinking it is. But we have a duty to explain to people and educate people about what it actually is. And what physician-assisted suicide actually is it's a prescription that you get from a doctor. Most often, it will not be your own doctor, because what we know from other states where this has become legal is that most doctors will not write these prescriptions. And so, for example, in Oregon, I believe it was the most recent statistics said that in Oregon, something like 13% last year of all prescriptions for physician-assisted suicide were written by one doctor in Oregon. So what we know is that there is great potential for abuse if this law were to go into effect here in Colorado. But once you get this prescription, you take it to a pharmacy just like you would take any other prescription, and you would fill it at King Soopers, at CVS, at Walgreens, and it comes back in a fairly large bottle because it's 100 capsules. It's 100 capsules that you have to physically break open into oatmeal, yogurt, a smoothie, and consume very quickly. Because what we know is that in the United States, the designer brand of this drug has become so expensive that most doctors, when they prescribe now in the United States, prescribe a generic brand. And as the Seattle Times exposed this spring, the generic brand has a lot of unfortunate side effects. And one of those unfortunate side effects is that it physically burns the inside of your mouth and throat as you consume it. So anybody that tries to tell you that physician-assisted suicide is a compassionate or dignified way to die is not giving you the whole truth, is not telling you what some of the actual side effects are to these drugs. The other thing that happens with the generic brand of this drug is that people don't die right away. It takes a lot longer for people to pass than it does with the designer brand of this drug. So there's a lot of unfortunate circumstances that happen when this drug is consumed. The drug has to be consumed quickly all at once because of these side effects. So this is not something that you're taking, a pill a day, or that you can, sip your smoothie throughout the day and you slowly pass away. This is something, because of the side effects, that needs to be consumed very quickly. So understanding that this is not something where you would go to a medical facility to have done is important for people to understand. This law would not require that any medical professional would be present when these drugs are consumed. In fact, no one has to be present when these drugs are consumed. And to even go further, once the drugs are prescribed, we have no idea what happens to them in Colorado because there are no reporting requirements in this bill and there are no safeguards in place to keep track of what happens when people take them, if people take them. It's a very dangerous proposition, and there are a lot of unintended consequences that the other side will not tell you about. And let me tell you a little bit about the other side. Who's behind this? That's a question I get a lot. Who is behind the effort to push assisted suicide? There is not a groundswell of grassroots people that are clamoring for assisted suicide in Colorado. As much as the other side would like us to believe that this is something Coloradans want, it's truly not. These are outside groups, national people who are coming into Colorado because it's a fairly easy process in Colorado to get something on the ballot. And if you have the money to spend to put something on the ballot, it's fairly easy to do in Colorado. And that's what happened with assisted suicide. For the past 2 legislative sessions, we have defeated assisted suicide in a bipartisan fashion at the Capitol. Compassionate Choices, the group that used to be known as the Hemlock Society, before they changed their name to something a little nicer sounding, is the group that is behind this effort across the United States. Their national headquarters is here in Denver. So this is home base for them. This would be a home win for them, and so it's important to them. They knew that they were not going to be successful in the legislature, so they spent close to $1 million to get signatures, to collect signatures, to get this initiative on the ballot in Colorado. Many of you might have ran into those signature gatherers over the summer. That was Compassionate Choices paying for those people to be out there to collect signatures from people in Colorado. To date, they have put in close to $5 million just in the state of Colorado to try and get this initiative passed. Many people ask, where does the money come from? Who funds this? George Soros is the main funder of Compassionate Choices and these initiatives around the country. And for those of you who don't know who George Soros is, he is a billionaire probably a few times over. He lives in New York, and he is a passionate supporter of Compassionate Choices and, before that, the Hemlock Society. And this has been a lifelong effort for him. In 1995, he did an interview, and I would encourage you to read it because it goes to show what kind of mindset of person we are dealing with that funds these kind of initiatives. In 1995, he did an interview with The New Yorker, and in it, he talked about his dad's battle with cancer. They asked him, about what that was like for him. And his quote was about his dad's cancer: "Unfortunately, Dad wanted to live. I was kind of disappointed in him, so I wrote him off." That's the kind of person that funds an initiative like this. He went on to say how proud he was, though, of his mother, who was a member of the Hemlock Society, and in fact, when she was diagnosed with an illness, decided to commit suicide, and how much he admired his mother and her ability to not only become a member of the Hemlock Society, but then follow through with her promise to him that she had made to kill herself when she got sick, so that he wouldn't have to take care of her. That's the kind of person that we're dealing with when it comes to these issues, when it comes to what's happening here in Colorado. This is the man behind the effort to pass this and to legalize this, not only in Colorado, but around the country. And so I think we need to be cognizant of that as well, of who is really behind this, because it's not the people of Colorado rising up and saying, we need physician-assisted suicide. Another important thing that we need to understand about this initiative is what it means in terms of cost. And what I mean by that is we become a number. Our healthcare becomes a number. It has a price on it. And I like to tell the story, for those of you who don't know, of Barbara Wagner. Barbara was a woman in her early 60s who lives in Oregon, who was diagnosed with breast cancer. Barbara was getting a new experimental drug treatment to to treat her cancer, and it was working well for her. She was doing well. She was living she had a very good quality of life dealing with her cancer. After Oregon passed their physician-assisted suicide law, Barbara, who was on the state Medicaid plan, got a letter from the state of Oregon. And in that letter, it said that they would no longer pay for her cancer medication because it was too expensive. But what they would pay for was for her to get a prescription for physician-assisted suicide. That was the letter that Barbara got. She couldn't believe it. She thought that it was wrong. She thought she was misreading it. She took the letter to her neighbor. Her neighbor immediately called the media. The media did a wonderful expose on Barbara's story. And what they ended up finding out once they did this expose was that Barbara was not the only person in Oregon that got this letter. People started coming out of the woodwork saying, I too got a letter saying my treatment was too expensive, but that they would pay for me to kill myself. I think that is extraordinarily, that should disturb us all greatly, to think that our loved ones, our family members, would get those kind of letters. What assisted suicide does, people will come and say, Jenny, I support this because this just sounds like the best way to go. I mean, if I'm at the end of my life and I'm suffering or my loved one is, I don't want to see them suffer. I don't want to suffer. I want to just be able to go out on my own terms, and assisted suicide lets me do that. And what I tell people is that is, yes, what you think assisted suicide would do, but understand what the flip side of that is. What assisted suicide and legalizing assisted suicide does is it takes away someone else's choice. It takes away someone else's choice who wants to live, who wants to fight. Because now we've put in place a medical treatment of suicide that is much cheaper than other treatments. And so when faced with choices, and faced with the type of things that not only doctors but insurance companies will be faced with when it comes to cost containment and healthcare, what is the cheaper option? As Archbishop Aquila mentioned this morning in his homily, there's another story that's come out of California just recently about a woman who experienced the same situation. What the Archbishop didn't have time to mention was that when this woman got her letter, she called the insurance company because it didn't immediately say why they had denied her treatment. So she called her insurance company and she said, why are you denying this? And they told her that it was expensive and that it was experimental and they weren't going to pay for it. And so then they brought up the idea, though, of the assisted suicide. And they told her and went through this whole long explanation with her as to why this would be a good choice. But they weren't going to pay for it. They were going to charge her an extra $1.20 to get those pills if she wanted them. And they would make them available to her at the price of $1.20. Her doctor, since that had happened, her doctor has appealed the decision of the insurance company 3 times. And 3 times her treatment has been denied. And all 3 times when she called the insurance company, they told her, for a mere $1.20, we will give you the pills to kill yourself. So these are the real consequences of what happens when we pass a law like physician-assisted suicide. It's important to understand that the nuances of this law, because this is not just a peaceful, dignified way to quickly end one's life. And this is not a law that does not have consequences. This isn't, people will say, well, if somebody wants to choose this, that's fine. Usually the answer they give me as a Catholic is, if you want to suffer and be in pain for the end of your life, you go right ahead, Jenny. Because that obviously is what the Catholic Church believes, is that people should die and suffer in great pain, is usually the response that I get. So I think debunking some of these myths of that is not, if people understand truly what the Catholic Church teaches, we don't want people to die in excruciating pain. That is not the point of end-of-life care. We have wonderful ministries and wonderful opportunities in this archdiocese, like Divine Mercy, that offer wonderful end-of-life hospice care for people that truly care for the whole person and their family. And those are the kind of conversations that we should be having in Colorado, not conversations about more suicide and saying that in some cases it's okay for us to say suicide is okay, but yet as a state over the past 2 years, we have passed legislation and spent hundreds of thousands of dollars to set up suicide prevention committees in this state. The past 2 years, we have set up commissions and committees that look at how we reduce suicide in this state. Because for those of you that don't know, we have a huge epidemic, especially amongst our young people. We are ranked number 1 in the country for suicide rates amongst young people ages 12 to 24. Number 1. And so to think that the message that we would be sending to our young people, if we were to legalize Proposition 106, we are saying to young people that in some circumstances, when you're suffering, when you're in pain, that suicide is okay. In these instances, for physician-assisted suicide, that kind of suicide is okay, but yet we're going to do everything in our power as a state to pass laws and spend lots of money to try and tell people that suicide isn't okay. It's a dichotomy that I just can't quite wrap my head around when it comes to lawmaking in this state. But that's what we would be telling people. That is the message that we send to our young people if we pass Proposition 106. And I don't think that that is something that we want to do in the state of Colorado. People ask me and they say, well, Jenny, aren't there enough safeguards in place? Don't you have to be terminally ill and less than a certain amount of time to live so that all of these things you're talking about would never happen? Yes, there are, in the law, it does say that you have to be diagnosed with a terminal illness and have less than 6 months to live. 2 doctors have to sign off on your request. There's a form that you fill out, et cetera, et cetera. None of those provisions in the law have any enforcement mechanism. So we have no idea if they will actually be taking place. We know in states like Oregon and Washington that do have some minimal reporting requirements. We actually have less in this proposition than both Washington and Oregon. But in Washington and Oregon, they do collect some statistics. And what they have found in some of the reports that have been filed with the state is that, in fact, there have been these cases of abuse where 2 doctors haven't signed off, where there hasn't been a 15-day waiting period that's been respected, where the people that are witnesses to those requesting the prescription are heirs and blood relatives. And in fact, in Colorado, the form that you would sign at your doctor's office says that there has to be 2 witnesses to your request. And one of the witnesses can be somebody who stands to inherit or is a loved one. So think about truly if that decision is actually being made with free will and not being coerced. It's a huge problem that we have with, you can understand the potential consequences and the potential abuses that would take place if this becomes law. The other very disturbing aspect of this is in terms of life insurance and what this does in that realm. And many people say, well, how are life insurance companies handling this? The aspect of this law that's not getting a lot of attention or that doesn't get talked about a lot is the fact that when a person dies and their death certificate is signed either by a coroner or a doctor, the law explicitly states that even if the coroner or the doctor, whoever's signing this death certificate, knows that the person died by suicide, by consuming these pills, they have to put on the death certificate that the person died because of their underlying disease or by natural causes. So they're asking doctors and coroners to, in essence, commit fraud. To say that, yes, we know that you died, that this person died via assisted suicide pills, but instead we are going to say that they died because of their underlying illness or natural causes or whatever it may be that they decide to put on that death certificate. These are the nuances of the bill that don't get talked about, that get missed in the bigger picture of the commercials about Brittany Maynard that we see on TV. But that's the poster for this issue, for the other side, is look at Brittany's story and how could any of us not want to pass this? But But I would encourage you, it's a very long proposition, it's close to 12 pages, but I would encourage you to read through it, because as you read through it, you will start to see some of these nuances that are quite dangerous and should scare all of us before we go and vote and think that we would actually pass something like this into law. I also want to talk about what are the consequences of this. I've talked a little bit about what some of the immediate consequences would be, but we also know, because we've had states that have had this legal for quite some time, namely Washington and Oregon, that have had to deal with this and see the consequences of this. And what's happened? Well, we know what's happened in those states. We know that, in fact, most doctors won't write these prescriptions. In both Washington, Oregon, and now California, which is the latest state to have legalized this, we know that there are doctors who set up one-stop suicide shops. So you can come and do all of your planning, you can get your prescription. I was just reading an article about a doctor in Washington who set up a whole home. He had bought a home and set it up so that people could actually come and die there, so they wouldn't have to mess up their house. They could come and pick out the room, they could pick out flowers, they could pick out music if they wanted certain music playing as they passed, and he would do it all for one flat fee of $10,000. We know that this happens. That's just one example. In California, the first woman to take advantage of their assisted suicide law was a 32-year-old woman who had been diagnosed with ALS. And she decided that she was going to have a suicide party. And so she invited all of her friends. She sent out invitations for a weekend of just a whole weekend of partying and getting to spend time with each other. And she said on Sunday evening, at the end of the weekend, I'm going to kill myself. These were the invitations that went out to family and friends. So come celebrate with me as I prepare to kill myself. Think of what that does to all of us, the effects that has, because we know that if it's happening in those states, it will happen in Colorado if it is legal. These kind of things are not made up stories that are meant to scare you. It's the reality, it's the truth of what happens when we pass something like this. It's dangerous. We know that these things happen. What else has happened in Washington and Oregon that should concern us? Well, it's the fact that the supposed terminal illnesses that we think are the ones that are being prescribed for, that people are getting physician-assisted suicide, are not necessarily what people are requesting this medication for. We know that the number one reason that people picked assisted suicide in states like Washington and Oregon was not fear of pain and suffering or being a burden to family. It was a decreased quality of life. They didn't have the same quality of life anymore. And so therefore, let's take my life, because I don't have the same quality of life. We know that the prescriptions that have been written in Washington and Oregon haven't been for the terminal illnesses that we would think of, like ALS or cancer or leukemia. They've been written for things like arthritis and diabetes. That's what people in Washington and Oregon have received these prescriptions for. So when we hear the other side out there proclaiming that this is for the most dire of circumstances, for people that are at the very end of their life, challenge them on that, because that's not the case. So we know what happens in Washington and Oregon. Now, what happens 30 or 40 years from now? Unfortunately, we have the ability to know what happens 30 or 40 years too from now, if this is legalized. We have to look no further than Belgium and the Netherlands to see what happens 30 or 40 years out. In those countries, they started by passing physician-assisted suicide in the late 1970s. The doctors who were helping to push this effort in those countries said, we will never move beyond physician-assisted suicide. This is all we want. It will never go beyond that. It will just be physician-assisted suicide for the most terminally ill patients that we see. Well, what we know 40 years later is that it has turned into something much greater than physician-assisted suicide. It has turned into full-blown euthanasia. And not euthanasia just for patients who are at the end of their life, but for young people, for children, In Belgium, they expanded the law 2 years ago to say that parents can euthanize their children at any age. We know just last month that there was a family in Belgium that was given the right by the government to euthanize their son who had been diagnosed with an illness because, quote, they didn't want him to suffer. So they had him euthanized. We know that in countries like in Belgium and the Netherlands, that they have mobile euthanization units that drive around the country so that people don't have to go to a clinic and will euthanize people for them in their homes. We also know that large amounts of people, especially the elderly in those countries, will not go see a doctor because they're afraid their doctors will try to kill them or suggest that they kill themselves. So we have a complete erosion of the doctor-patient relationship that is so sacred to so many people, that is completely broken down because of people's fears, and rightfully so, in countries like Belgium and the Netherlands. So people aren't getting or seeking the care that they might need for fear of being told that their only option is to kill themselves. We also know that it has expanded greatly to include a case that just this year many of you may be familiar with a young woman who I believe was 21 or 22. And she had been diagnosed with PTSD because she had been sexually abused as a young girl by a family member. And she had suffered with that throughout her life. She was seen as a psychologist, and they had diagnosed her with PTSD. And she decided that she wanted to take advantage of the assisted suicide laws in Belgium and kill herself. Her doctors agreed with her and thought that that was a great idea. They in fact said that PTSD is an incurable terminal condition, and therefore she had the right to take advantage of the laws in Belgium and the Netherlands. It went through a whole court process because her family was trying to contest it. They did not want her to kill herself. The family lost, and she won. And the country of Belgium said that yes, PTSD is an incurable terminal illness, and people can now take advantage of assisted suicide or euthanasia, whatever it is they want to do. So we know where this leads 30, 40 years down the road. And it should scare us. It should scare us greatly to know that that is the kind of state that Colorado would become. We know what happens when we pass laws without really doing our due diligence and understanding the ramifications. I think in Colorado we know all too well, unfortunately, what happens when laws get passed without people really understanding what they are. So I would encourage you as we get ready to vote on the issue of Proposition 106 and a lot of other issues, that we take the time to educate ourselves on what actually these issues would mean, what they do, and what the ramifications of them are if we legalize them in Colorado. We have a lot of work to do. I hope that for most of you, I am preaching to the choir when it comes to the issue of physician-assisted suicide. But please don't take for granted your family members, your friends, your fellow parishioners. Our polling also found in August that only 47% of Catholics in the state opposed physician-assisted suicide. So we have a lot of work to do in our own homes, in our own families, in our own parishes when it comes to this issue. So I would encourage you to not take for granted that just because your neighbor is Catholic or a family member is Catholic that they're going to be voting against this. There's a good chance, over a 50% chance, that they may be all in favor of this type of initiative. And so I would encourage all of you, if you take nothing else away from this talk today, that you go and talk to friends and family about this issue, that you understand and help them understand what is really being done if we were to legalize and pass physician-assisted suicide in Colorado. I know this election season has been a tough one for a lot of people, and it seems that it is even getting harder by the day as we move closer and closer to November 8th. And a lot of people have come to me and said, I don't think I can even vote, Jenny. I think I'm just going to stay home. I'm not going to send my ballot back. And I would encourage you that if any of you are feeling that way, please stop. Stop feeling that way. We need to get out and vote. That there is a lot of people that will try and suppress that vote to say that there's no good choice, so just stay home. Don't fill out your ballot. I'm here today to say that is never the answer that we as Catholics should have. Our answer should never be not to participate or not to be involved in the public square. We have a right and a duty to speak up, to make our voices heard, and never has it been more important in this state to make our voice heard than it will be this coming November, where physician-assisted suicide is concerned. Recently, Archbishop Chaput gave a talk at the University of Notre Dame, and I thought he put a wonderful quote in his talk, and he said, "We need to be people of hope, which means we don't have the luxury of whining." And I thought that was classic Archbishop Chaput, but it also is exactly what we need to be thinking, because we have all been in this cycle now of this election for a very long time. And I think it's very easy to have this feeling of hopelessness when it comes to the issues we're talking about and the state of culture and the state of where we're at even in Colorado today. But we are people of hope, and there is always hope, and we have to have that hope, and we have to hope that the people of Colorado will heed the call that we have been proclaiming in all different kinds of venues throughout the state, to vote no on physician suicide, to protect life, and to uphold the dignity of all human life, especially at its end. And so I would encourage all of you, if you haven't done so already, I have a table over at the side here with some more information about physician-assisted suicide, about some of the issues. There's an FAQ sheet that you could take home and give to family and friends about the issue. And there's also, finally, I would be remiss if I didn't say that we have to pray. We have to pray for our country, for our country's leaders, for this upcoming election, and for our state, and for our church, and for our church leaders as well, that we will be the voice of truth in our culture, and that we will have the courage to speak up, especially on these important issues that are going to have a tremendous effect on all of us.